Uganda is currently estimated to have a population of 40 million people. The people working in the Middle East constitute over 250,000 people of the overall population. Many youth are vulnerable due to high unemployment rates around the world, family instabilities, poor parenting, high household poverty, and the impact of HIV/AIDS. Currently, Uganda is one of the youngest countries in the world, taking the 31st position in terms of dependency ratio. The majority of this population has been subjected at one point or another to vaccination against the 5 killer diseases, a case in point being the yellow fever vaccine, which was invented in 1934. To ratify this protocol, the government of Uganda mandated UNEP under the Ministry of Health to ensure vaccination for all its citizens.
Yes, Ministry of Health and UNEP, fantastic. We thank them for not turning a deaf ear to us. They opened up. They said, fantastic. We had relevant meetings with NITU and Ministry of Health, and that's why we're here today. And I'm sure we have not disappointed them. aelhu has done tremendous work with the short time space that it's had. We are currently monitoring yellow fever in the country, which we have made an app which has done significant work in the health sector, specifically for yellow fever. We are providing transparency, and we feel that this app can even go into different sectors. We are an association that listens, we are an association that understands the needs of people, we are an association that is efficient.
Under the NRM government, Uganda instituted the externalization of labor program and housed it under the Ministry of Gender, Labor and Social Development. By 2014, there were less than 5 companies that were directly involved in this business. Currently, about 360 labor recruitment companies have been licensed in Uganda for the same business. Over 5,000 Ugandans are approved by the Ministry of Gender, Labor and Social Development on a monthly basis to work abroad. So part of the regulatory requirements for externalization of labor, a worker is required to undergo mandatory testing for notably the following: HIV, HCG, TPHA, hepatitis B, and physical fitness. This is done in 3 levels: the pre-medical tests, the GCC tests, and the pre-departure tests. Vaccination against yellow fever is yet another recruitment. To this effect, in 2020, the Association of Externalization of Labour Health Units was founded by Honorable Florence Nachawala Chiyingi and was launched by the State Minister for Labour in response to the overwhelming irregularities in medical examinations handled outside the GCC mandate.
We are here to launch the online verification of yellow fever, where it's no longer manual, that you look at a card and say this is valid or not valid, but you will simply talk to machines, you and the machine. So we encourage all health practitioners to acquire yellow cards from the Ministry of Health, then execute their mandate that was given to them validly, vaccinate using the right vaccines, and then present certificates here at the border points, which will be validated using a barcode.
The accredited health units who are from the effect of this program registered online and were authorized by the Ministry of Health to carry out yellow fever vaccination and validation to all, starting with migrant workers. The authorized systems management team, comprising of aelhu and airborne staff, verified the barcode at the airport using a barcode scanner.
I'm called Mulumba Matthias Mulyowa. I work at IT Associates who under aelhu. I do yellow fever verification here at the airport. When a traveler comes in, I ask them for their yellow fever. I get it. I use this machine to scan the barcode. It's called a barcode scanner. We scan the barcodes in the yellow fever book that are now gotten from the Ministry of Health. When I scan the barcode, it brings the patient's details, the passport number or an NIN number that was used, plus the hospital that we were vaccinated from, and the date they were vaccinated, plus the vaccine that were given. If, for example, this is the barcode that we scan from Jabez This is Jabez. This is a yellow fever book from Jabez. If a book is not authentic, my machine will show me that it is either a fake barcode or a forged barcode, and those are the kind of people that we send to the airport clinic called Kazuri, and they are vaccinated again.
The Association of Externalization Labor Health Units is a non-government organization that aims at digitalizing validation and verification of yellow fever vaccination certificates, alleviating the suffering of the migrant workers through illegal yet expensive medical tests, increase government revenues through curbing irregularities in the associated medical businesses, lift the burden of responsibility medical irregularities from labor companies to the association, and furnish data to the government regarding the associated medical practices, among others.
The system has minimized the forgeries that were occurring. Very many people were not vaccinated, people were just getting books from anywhere. The data that we collect, it helps both the association and the government to know how many people are going out on a monthly basis, how many people are coming in, how many migrant workers. As per now, we have no challenges. The system has not yet given us hard time.
A number of offices have been set up, and these include Kampala BMK Apartments, Suite 802,
As aelhu, we look up to employing people who are competent enough, transparent, and people who won't be compromised in any kind of way. Because this sector, we take care of people's health. We try as much as we can, or like as much as possible, to look into people's like character during the probation time and stuff. So we give them enough time, and ourselves as an association willing to serve the country. So we give them enough time to see who these people are. Yeah, we have people that work day and night shift, because you know at the airport work is going on during the day and in the night. So some people work during the day, and then later on the other ones come in the night. But now, for the few months this program has been going on, we've actually noticed that the forgeries have reduced. People used to do fake yellow fever books, like the borders on the borders, and then even the airports. There are always people who want to do that kind of work cheaply. But it's not good, because people are at the end of the day going to get sick because they didn't take the vaccines and stuff. So aelhu has really helped in that way. We do trainings to make sure people don't get off track. Yeah, we do trainings, we teach them how to be careful.
Entebbe International Airport, first floor administration building. Elugu Port of Entry, ground floor, and URA building. The first ever online application to verify and validate yellow fever vaccination certificates was approved and adopted by the Ministry of Health. A memorandum of understanding was signed between Airmond and aelhu for the use and management of the application.
My name is Hanan Said. I'm the branch manager in Entebbe Airport. It helps us track travelers, it helps us keep records, and it also helps us curb the levels of fraud, especially when it comes to yellow fever books. aelhu works hand in hand with Ministry of Health. We work with hospitals that are accredited to vaccinate passengers, especially the migrant workers, such as Selmec, Lisa Medical, Novick Hospital, Cambridge Health, RK Medical, Cleveland Medical, to mention but a few. The system is very fast, efficient, and effective. Since it's online, all we have to do is scan the code and ensure that the details that the code brings up match the details that are in the passport of the passenger. We would like to thank Ministry of Health for taking up this initiative, because the system is fast and effective, and I would also like to recommend that it should be rolled out to other travelers.
Yeah, we have a number of medical doctors now because this is the thing. We came together and we had to understand the basis of travel medicine. We have to understand the different health-related issues that migrant workers go through, or that even the general public as well. But we tried to we had to do our research, try and streamline the health sector in whatever capacity that we were able to. So there are quite a number of doctors that do expertise from UNEP as well to guide us in the whole vaccination program. We have secretaries from the Ministry of Health as well. Oh no, it will be traced right now for every accredited health unit that is under aelhu. Everything is able to be back traced. So if there's a problem with your verification, one or the other, and you went through the proper channels, that has not come up yet. All the ones that went through the proper channels have actually been able to go through smoothly. But if at any one point some funny play, came in, we'll be able to stop it.
Even as a facility, it's easier for me to check on Tuesday which patient did I work on. If someone comes, you can easily find that information. For you to be fit to travel, you should have vaccinated 10 days early. So you vaccinate 10 days early, so at the airport they will verify, oh, so-and-so vaccinated from Lisa Medical Center on such and such a day, and even it has the specific medical worker in that hospital, their accounts for each nurse. So if someone just picks a card and they have not vaccinated themselves, and it's equally like any other vaccine, recently COVID, some people had some wrong information about the vaccine they were hearing. So you might have, you get the card that if someone, you dodge the normal system and maybe you corrupt someone and they give you a card, and you go to a place which has a high prevalence of that disease, they would have vaccinated you against, you'll end up contracting that disease. And now maybe if they follow up, like if you are vaccinated, ideally you're not supposed to get that disease. So maybe there will be questions. Also, which facility did you vaccinate from? The follow up, maybe if they find out from a certain facility, most of the people who left got yellow fever.